Hello, Dr. Keku and Dr. Gomez. My name is Annie Lee, and I am currently a family medicine resident doctor, completing my master's in public health from St. George's University. I will be presenting on my Capstone project entitled Lifestyle Modifications Preventing Type 2 Diabetes Mellitus in Low-Income Communities within the United States. As a future primary care provider for the underserved and the low-income communities, I will be faced with challenges that my patients will have when it comes to financial, language, and cultural barriers towards their access to care. These determinants of health make primary and secondary prevention difficult when it comes to treating chronic health issues, such as diabetes, within these communities. I was particularly interested in the recent national campaign that was launched by the U.S. Centers for Disease Control and Prevention to combat obesity and the diet-related disease of diabetes. Through the National Diabetic Prevention Program, NDPP for short, I wanted to understand how this program will play a role in the diabetic management I will provide to my patients in the future. According to the American Diabetes Association, 1 out of every 3 Americans today are pre-diabetic, but over 90% are unaware of their diagnosis. As the 7th leading cause of death in the US, diabetes overall has been reported by the CDC to have a 9.4% prevalence, with over 1.5 million new cases diagnosed each year. Prediabetes has been shown to lead to early forms of end organ damage, such as neuropathy or nephropathy, which makes diabetes a costly chronic disease. As a result, research has targeted preventative interventions and reduction in progression of prediabetes and type 2 diabetes mellitus. Utilizing 27 different resources, I conducted a narrative review on the social determinants of health that predisposes one to prediabetes. In addition, I further researched the NDPP protocol and alternative studies that have been developed using the NDPP as a foundation. The results showed that lower income communities were at a higher risk when compared to more affluent communities in developing diabetes. Further research on the NDPP, conducted by the NDPP research group within the United States, revealed its success in reducing the incidence of diabetes through lifestyle interventions of diet and physical activity requirements, but lacked cost-saving measures that would make implementation of the program in low-income communities very challenging. Alternative NDPP-like studies that used a portion of the NDPP protocol while implementing their own cost-saving measures to compensate for limited resources had resulted in promising options in diabetic prevention for low-income communities. I want to highlight one NDPP-like study conducted by Ackerman et al. Within the YMCA, a national nonprofit youth program that promotes healthier living within the United States. The study implemented alternative fingerstick glucose testing and questionnaires using NDPP-trained YMCA staff to carry out the screenings and sessions, rather than requiring a hospital visit, a clinic visit, or physicians. The study yielded promising reduction of incidence of diabetes and prediabetes in local communities, without having the costly implications as seen before in the NDPP. Unfortunately, this study, with other studies along with the NDPP, lacked longitudinal data to analyze the efficacy and effectiveness of these types of interventions on a long-term scale. In conclusion, there needs to be more emphasis in research on understanding the effectiveness of the NDPP and other NDPP-like studies within low-income communities to better gauge a program suitable for such a vulnerable population. I have learned through this project that as a public health advocate and health provider, we must always remember to research the programs we try to implement and recommend for our patients. As promising as the NDPP has shown through its trial, what may be applicable to one community may not be feasible for another. As a result, we must continue to develop and promote research in creating patient-centered plans for patients at risk of diabetes and other preventable diseases so that we can increase the quality of life for all, despite income or other social determinants of health that stand in the way of healthy living. Thank you very much for the opportunity to present and to take part in such a fulfilling project where I can apply what I learned about the diabetes prevention program towards my role as a provider, a public health advocate, and a voice for the underserved. Thank you again, and have a great day.